Us here on the second half of the Factor Uncensored. For some, it may feel like the COVID-19 pandemic is over, but that definitely isn't the case. In fact, it's still affecting vital resources. There's reportedly a shortage of Texas healthcare professionals. According to Mental Health America, Texas comes in last place for access to child mental health care, and at number 33 when it comes to mental health services for adults. Joining us here on the Factor Uncensored for this conversation tonight, therapist, Saudi attorney, Dr. Bernadette Smith, and Dr. Christine Belliard. Glad to have you all here on the Factor Uncensored. Now, I think it was just last week I got a heartbreaking email from a parent who said, I have tried to get the help I needed for my teen daughter and can't find it anywhere. And she says, when I took my insurance to certain therapists or psychiatrists or psychologists, no one's taking insurance. It's all a cash business for some. So how did we get here in Texas or in the country?
Yes, how did we get here? So one thing that people have been so excited about is that the stigma against therapy is starting to fade, which is beautiful.
More people
want the services.
You just can't get it.
You can't get it because we do not have enough professionals. We do not have enough behavioral health care professionals. This is a crisis in itself. I wish that young lady's experience was unique, but unfortunately that is the case. So one thing that's really critical is that, one, we look at what are the available services and how can we try our best to make sure that people at least know how to get the services, and if they want it, if there are other ways that they can access the benefits. Like, for instance, most companies do have an EAP, Employee Assistance Program. So you've already paid for the services through your company. Or if you're a student, whatever school you go to, your student services. Sometimes we do have to be creative right now. I wish I had a pretty answer, but it is a reality that it is difficult to find a therapist now. But don't give up hope. There is help out there.
And Sadia, for those who may run into a therapist, a counselor, psychologist, psychiatrist, who may not show interest in this case, how do you even deal with that?
Who may not show interest in the lack of clinicians that have been available?
No. As a patient, if I go to you and there's a lack of interest.
Yeah, so
moving them in, moving them out.
Yeah, so just like any other relationship, the therapeutic relationship is just that. And it does take time to find someone that is a good fit for you. So although there is a shortage of therapists, it is so pivotal that you don't give up looking for the right therapist. It may take longer, but that relationship that a patient has with their clinician is so important to treatment outcomes. And you will, I mean, as with any profession, you may find people that are not qualified or that are burnt out. A lot of therapists have been slammed with clients taking on a lot more than they normally would. And so that feeling that a patient may have of this therapist is not interested in me may come from the therapist being burnt out, which is not the patient's fault. It's not their responsibility, but it does mean that they might have to go and search for a new therapist, which could take some time.
And Dr. Smith, if you don't have time to forge that relationship with your therapist, your psychologist, whomever, what is a parent to do, especially with children, because it's crucial with them, and parents will suffer if their children, if they do something that may be catastrophic. So how do you deal with that if you're not getting what you need in the form of clinical help for your child?
So one of the things that can be frustrating is meeting a therapist and then opening up, and then you're spending hours with them to find out that they're not a good fit. And so a lot of therapists, including the therapists at my practice, we offer free consultations that are about 15 minutes. So it does give people the opportunity to see, is this a good fit? And because of the way social media is and because of websites, you also have the opportunity of looking at some of the videos that they might have put out, because I get clients who said, oh, I saw your video and it resonated with me. And so I think, again, it really comes down to saying, this is worth it to me, it's important to me, and interviewing your clinician, and it is a good fit. And one of the things I tell my clients is we try on shoes and the shoe may not fit, but we don't give up on shoes. We just keep on trying until we find that right fit, and the right fit with a therapist is what's ultimately going to help you reach your goals.
And for any of you, if it's an emergency situation for a parent out there, what can they do? Are there any other options than getting a clinician, like your primary care clinician, getting some kind of help for that child who may be in distress?
Yeah, absolutely. You can, I mean, if a child is really, if you're in fear of their health and safety, then there are hospitals in the area. They can be taken in to see their PCP, their primary care physician, just to have initial assessments done to determine what their level of care is needed is. They can also go through their school and use their counseling services at school to get some assistance with that as well.
And really quick, what do we need to do to increase the number of clinicians here in Texas and around the country?
So good. One, it is a money thing. So I know that there's legislation right now on the docket to increase funding for mental health services. We need to support those. Also, it is critical to ensure that parents advocate, and I agree with going to the school because they're mandated to make sure there's treatment, and then also ensuring that if you know that you have an interest in therapy or counseling, come join the field. This is an opportune time. Baby boomers are starting to retire. There was already going to be a shortage. After the pandemic, oh my gosh, it is critical. In Houston, we do have a behavioral health network, and so there are so many agencies who are looking for their scholarships. They're looking for clinicians. So if you're interested, I say join the field. I know as an educator in the field of counseling, it's critical, especially if we want culturally relevant services, that we really are the help we're looking for.
All right, doctors, counselor, thank you all for joining us here on The Factor.